Welcome to Missing Briefs, where we unveil the untold business stories of lawyer triumphs and trials. I'm Dominic, the founder and owner of Elevate Business Coaching, a Boston-based business coaching and consulting firm that specializes in teaching law firm owners and their lawyers how to build, manage, and grow successful practices.
And I'm Bob Furlong. I'm a certified exit planner here in Boston as well. I help attorneys and their families do financial planning, and I also help attorneys who found practices plan to attract and retain their best people and have a path to exit.
So, Missing Briefs, what's it all about? Well, it's about exploring and telling the compelling stories or briefs of lawyers who have significant or who have experienced significant challenges and successes in the business of law. What was their gap? What were they missing? What is it that they wish that they had known? Well, it's our pleasure today to welcome Jamaal. Jamaal is a Miami-based health attorney and the founder of Jones Health Law, where he has spent nearly a decade representing healthcare providers and organizations in regulatory, licensing, and compliance matters. He's had experience spanning Florida, Tennessee, DC, and on and on. And Jamaal has become a trusted advisor on the complex issues that shape modern healthcare today. His leadership includes serving as immediate past chair of the Florida Bar's Health Law Section, and his work has earned recognition such as Super Lawyers Rising Star and multiple under 40 honors. He brings a practical, informed perspective on the business and the legal realities facing today's healthcare professionals. After all of that, Jamaal, how are you today?
I'm doing well. Dominic, thank you for inviting me. It's really an honor to be here with you guys, talking a little bit about my experience as a health law attorney.
So, Jamaal, welcome to the show. Let's take a little trip to yesteryear. Can you share with us a little bit of information about when you decided, hey, I think I want to be an attorney, and what happened then?
Sure. So I wasn't one of those people that grew up with an idea of what they wanted to do as an adult. Um, yeah, I knew I wanted to be in business, so I could own a mechanic shop, I could own a nail salon. I wasn't one of those people that grew up knowing exactly what I wanted to do. I knew that I wanted to be an entrepreneur, but wasn't exactly sure which route I would take to do that. When I was in college, I was pursuing a degree in biology, and I decided to make the decision to become a doctor. I've grown up, your family tells you, hey, why don't you become an accountant, a doctor, a lawyer, et cetera. So I decided I'm going to follow the playbook and go to medical school. While I was in college, I was doing some some volunteer work, and I realized that medicine is just really not the career path that I want to choose. And one day I was studying for a biology final. One of my buddies asked me if I considered law school. I said, no, I hadn't really thought about it. But after doing a little bit of research, I decided that it was something that I wanted to pursue. And I ultimately decided to go to Nova Southeastern University here in Florida because I was tired of freezing my butt off in Baltimore. And it was one of the few schools at the time that had a concentration in healthcare law. And it really gave me an opportunity to continue to work in the healthcare industry. I knew that behind military spending, the next highest percentage of the country's GDP was spent on healthcare. And I figured I'd probably always have a job. So that was really my motivation for becoming a lawyer and specifically becoming a health law attorney.
It's kind of cool that you took your experience in pre-med and biology and kind of lateraled over into the law, and so it must give you a very specific outlook or knowledge base. And that kind of leads me to my next question, which is related to what really drives you so much in this area of the law, as opposed to, because lawyers graduate law school pretty much they can kind of go any path. Why did you choose this, and why is this really the thing that you love to do most?
Yeah, you're right. I mean, when I graduated from law school, I probably graduated at one of the worst times for attorneys. We were in the middle of a recession. I graduated in 2010, and there weren't very many opportunities available unless you wanted to go into insurance defense. And that was something I didn't want to do. I didn't want to pigeonhole myself into a career in insurance defense. So I actually graduated from law school, passed the bar, and was unemployed for probably almost a year because I
Mm,
was very focused and very determined on working in healthcare law. I mean, for the past 3 years of law school, I'd really just focused my studies on healthcare, whether it was managed care litigation, charitable organizations, elder law and psychiatry, any subject matter that I could take that was related to the practice of healthcare law. So to depart from that just wouldn't have served me well at that point, including the fact that I interned at the Attorney General's office in the Medicaid Fraud Control Unit.
Ooh.
I was the president of the Health Law Society at law school, at my law school. So, that was really kind of what made me continue to pursue this path in healthcare law.
Mm,
that's
that's
terrific.
great.
That's
Thank
a
you for
really
sharing.
interesting story, the way you kind of laid it out. You weren't expecting, you wanted to be a business owner, you hadn't thought about being a lawyer. Someone puts it in your head, you check it out, and then you'd overlap it with the healthcare field. It's pretty interesting. So you graduate, you get your first job. Can you tell me about your first employment straight out of school?
Yeah, so my first job was working at a law firm in Coral Gables, where they focused their practice on managed care litigation. So, what does that mean? That means that we represented health systems, hospitals in disputes with insurance companies. So, a lot of times, what happens is the hospital will have a contract with the insurance company, and many times the insurance company, which insurance companies do, is they don't pay or they pay less than whatever the negotiated rate
Mm,
is. So the hospital will hire us to step in to help negotiate either better terms for the contract or to ultimately get paid whatever the hospital feels it's owed.
right.
So I did that for about 3.5 years. It was a wonderful opportunity for me to get my foot in
Mhm.
the door doing litigation. I still have a great relationship with that firm to this day. But I decided that it was time eventually for me to move on to another firm so that I wouldn't be a one-trick pony.
Yeah.
And I wanted to be multifaceted in terms of my approach to healthcare law.
Okay, great. So you graduate, you get some experience, you're doing litigation, etc. But we were just talking before we came on live. You actually made the jump to starting your own firm at age 30. So I want to talk because that's early to embark onto entrepreneurship, right? For most people are scared to death, Jamal. They think I just want to pay a check. Most people are not as adventurous as you to start out at age 30 with your own firm. So I want to ask you, what were some of the key challenges that you faced when you first started to build your own practice?
So, Dominic, when I decided to open up my own firm, I was single, didn't have any kids, so I figured now was the time, right? If I need to eat
Mhm.
spaghetti every night, I could do that. I didn't have a family to provide for. And truly, the reason why I decided to open up my firm was because I was working at another firm. And for one reason or another, that didn't work out.
Mhm.
And I was looking for employment elsewhere. And I was having difficulty at that point because I was about 4 years out. And many of the firms that I was trying to find employment with were asking if I had a book of business. And I didn't
Yeah.
because the firms that I was working at had all the business and they just wanted us to work. So I said, you know what? Why don't I go out, build a small book of business so I become more attractive to a potential employer?
Mhm.
Well, fast forward 10 years, and I still haven't joined another law firm yet. But starting my practice required me to quickly shift from being purely a what I call a legal technician,
Yeah.
right, a grinder, for running a business. So the biggest challenges were building a consistent pipeline of clients. I didn't have a single client when I opened up my business, no one. Managing cash flow in the early stages and learning how to effectively market my services without having a clear roadmap. At the same time, I had to develop certain operational
Mhm.
systems, everything from client intake to billing, while of course still delivering high quality legal work. So I certainly had my hands full in those early days.
Yeah. It's interesting. For me, I never thought I'd be an entrepreneur, but it was the necessity was the mother of invention, like you. I couldn't find what I was looking for. Nobody was going to give it to me. So I guess I said to myself, well, I guess I just need to do it myself. I'll employ myself. And for you, you were smart enough to realize early that, having a book of business is what gives you mobility, independence, leverage, I guess, if you like. And if I don't have it, why don't I get started on it? So that's terrific that you came to that conclusion or recognized it so early on. Thinking back, because now you're 10 years into having your own business and you've mastered, all of these things that, were not within the realm of being a technician, right? You're now a business owner, right? An entrepreneur. Knowing what you now know, what would you have done differently?
There's a lot that I would have done
Tell me.
differently. I was just figuring it out
Yes.
as I went. Um, I would have been more intentional about building systems and relationships from day one. Early on, I think I spent too much time reacting instead of designing, excuse me, a scalable practice. I would have invested sooner in mentorship as well, because I think that's really key. That's critical. It allows me to avoid some of the pitfalls that I've had to experience on my own and learn the hard way. I would have also invested in better technology and clearer processes for client acquisition and retention. I also probably would have narrowed my focus a little bit earlier so that I could be more selective about the type of work that I do and the clients that I took on, just to build a better brand and reputation within a specific niche in a niche. So those are definitely some of the changes that I would have made.
Of all of those, because there's a lot there. So which do you think is would be the number one? So for folks that are listening and maybe they're thinking about taking a leap, what's the one that you'd suggest the most has the most importance?
I would say relationships.
Okay.
Building relationships is really important because it really drives so many other aspects of the
Mm,
business for me. When we think relationships, we think, okay, clients. But I've received a lot of support from other individuals, been very um, free with the information that they would share with me about the administrative aspects
mhm,
of my business, right? So many of my colleagues will say, hey, have you tried this insurance company
mhm,
for your practice? Have you tried this CRM
Mm,
system?
mm,
Have you tried this type of intake form? Whatever the case may be, I've learned a lot from
mm.
other people,
mm.
and I wouldn't have been able to have access to that information if I didn't build those relationships
Yep,
with individuals who were almost as equally invested in my success as I was.
So
I like
Jamal,
that.
you've been an attorney for a number of years, building this business that you have now, and have years and years to come in working as an attorney. When you decide to hang up your skates or cleats, or decide to retire, or suspend working in the law, how do you want to be remembered?
Yeah, that's a great question. I haven't really given too much thought to that, being that I think I'm still a relatively young attorney. So I got a lot of road ahead of me, but I'd like my work to be remembered as both effective and meaningful, where clients felt not only well represented, but genuinely supported during important moments in their lives or businesses. Beyond outcomes, I want to be known for integrity, clarity, and helping people navigate complex situations with confidence. If my work, of course, also contributes to setting a higher standard for how legal services are delivered, more accessible, more transparent, and of
Mm,
course, more client-centered, that would, of course, be a lasting impact that I would be proud of, as well as the work that I do for the volunteer organizations that I'm a part of, whether it's the Florida Bar or Big Brothers Big Sisters, which is an organization that I
mm.
personally support.
That's great. And Dominic and I were talking before the podcast about the importance of having you on, because there's so much going on regarding healthcare and getting paid by insurance companies, and I think people can be often confused, and I think often non-attorneys are confused by people that specialize in a certain area, that it's important to work with a specialist when you have a specialized problem. So I'm sure even people who are listening might be thinking, well, maybe Jamaal is somebody I should talk to. How do you like to be introduced? What's the best way that they can connect with you, and how is the best first steps for them?
Sure, absolutely. They can certainly learn a little bit more about me and my firm by visiting our website at www.joneshealthlaw.com. We really strive to provide education to our clients. So we have a blog post on our website. We also have a podcast. You can find us on any podcasting platform by typing in Jones Health Law. We also have a YouTube page. Again, type in Jones Health Law. You can find us. Same for social media. All of our social media handles are at Jones Health Law. Of course, they can call the office at 305-877-5054 or personally send me an email at jrj@joneshealthlaw.com. We're pretty responsive. I know we've had a lot of clients over the years that have contacted us after hiring another attorney to assist them, but there was just a lack of effective
Mm,
communication. So we really pride ourselves on being able to uh, reply to any form of communication that we receive within 24 hours.
that's outstanding.
Terrific. So lots of options there to be able to get in contact with Jamaal and his team. Lots of information, education materials. So, go on there, check them out, or reach out to them just like Jamaal suggested. Jamaal, it's been great. I appreciate you coming on to talk with us today, and congratulate you on all your success that you've had in your first 10 years, and looking forward to see what's to come in the future ahead. Thanks for being with us.
Awesome. Thank you so much. I appreciate you both having me on today.
Okay, so missing briefs, where we unveil the untold business stories of lawyers, their triumphs and their trials. If you have an interesting story to tell about your own triumphs and trials of owning your own law firm, or perhaps you know somebody else that does, please get in touch with us. I'm Dominic Grew.
And I'm Bob Furlong.
Until we meet again.